So you just hurt your low back in an accident just a day or two ago, and you need to know what to do to make the best out of your pain, how to take your pain down. I got a quick video for you guys, 6 tips of what you can do to make sure your back heals as quickly as possible and you're as pain-free as possible through the process. So listen up. And really quick before we get going, I recommend you guys subscribe to Riley Rehab because every single week I'm going to be making new videos, making you the expert of your own body and helping you get these kind of injuries under control. So with that being said, low back pain, there's a lot of types, but what I'm talking about specifically here is low back pain that you have immediately after you felt like your back just started hurting, like you're really cramped up, you're in a lot of pain. If you were to bend forward, you'd be screaming. The first thing, this isn't one of the ones, but I would say go check with your medical provider first because there's many times you do want to have this carefully looked at before taking any advice. But the 6 tips here I have in general work for most people with low back pain. So listen to these and take it with a grain of salt. So the first one is you want to change positions regularly. For me, I say that you don't want to spend any more than 1 hour in one position because the thing with low backs is as soon as you're in a position for a long time, the body starts getting sore, and as soon as you move in that position, it'll actually make things worse. So this gets into more detail with the other things, but make sure that you never lay down for longer than an hour, make sure you never stand for longer than an hour, and never sit for longer than an hour, and you're always moving, you're always changing positions. Obviously when you're sleeping, that doesn't really count, but in general, you don't want to lay on the couch for the whole time. The second thing is when you're laying down. So I'm not going to say don't lay down because it's totally fine to lay down when you had a back injury, especially if you need to rest it. But the one thing that really helps if you are to lay down is to take a pillow, roll it up, and put it underneath your knees just like that. What you're doing here is you're raising the knees up and you're taking a lot of the pressure off your spine. So you're helping relax all the muscles, help calm down all the pain there, so you're in a really comfortable position and you can just rest there with the least amount of pain. This is a really good way just to help make your rest as good as possible and take the pain down. And the third tip I have for you guys is you want to put some ice on this. Especially in the first 48 hours, it's really important, put some ice on this. How I would recommend doing it is either with you sitting, you put it behind your back. Make sure you have a layer of towel or 2 in between the ice pack there so you don't burn yourself. But you just put it there on the spot where it hurts. You can lay down on it while you have the pillow under your knees. You can put the ice pack under your back. I would especially make sure you have enough layers on this because when you lay down you are putting more pressure on. But the ice is really good. I do 10 minutes at a time, and you can really do this up to 5 times a day. It's a really good way just to take the pain down. If there's any swelling, it can calm it down, and it can make the muscles kind of relax too, getting rid of that cramping feeling. Then tip number 4. Now this is one that a lot of people overlook, and that is when you're laying in bed or laying on the couch, wherever you happen to be, you want to make sure that you keep your shoulders and your hips pointing in the exact same direction, which the most important part for this is when you roll out of the couch or out of your bed, you want to roll like a log. That means your whole entire body will turn like this. You're not twisting just at the shoulders and then bringing your hips behind, which you might normally do if you weren't injured. You want to keep your hips forward, shoulders forward, roll the whole thing together. So when you do that, you can take it really slow there and roll there, because this is a point where if your back is in a fragile state, there's a high risk you're going to pull something again. So you can roll there. And then when you get up, you can kind of push up with both your arms here, going this way. Really key point, and it's easily underestimated by people because they're so focused on just the getting up part, and they don't really realize how critical that is. But I would say anytime you're making that transition from lying to standing, you want to make sure you roll over like a log and then push up from the side. Then tip number 5 is you want to walk. This is something that's often a lot of people don't realize that the importance of walking when you have back pain. I would say 90, 95, 99% of back injuries, you go to any doctor, any surgeon, and they are going to tell you it's okay to walk and you should walk regularly. I've even heard in some cases when people have fractures that they still tell them to walk. I would still check this with your healthcare provider personally, but I would say in general, walking is the best thing you can do for your back, assuming you're not overdoing it. Even if it means every single hour just kind of getting up, walking around, taking a little walk to the windowsill or to the bathroom. Those can be really important because you don't want to spend the entire day just lying down in bed, as comfy as it may seem at first. You want to walk. Think of it as your basically introductory rehab exercises to build that back up. You're obviously not going to be hitting the squat rack anytime soon, but imagine when you're getting up, you're actually doing stuff to build the strength in those muscles and help yourself get better faster. And the last bit of advice I have for you guys is to stretch it. And this is one where I want to be careful to give this advice because you don't want to do some crazy aggressive stretches on the low back. If you just heard it, it's still pretty fragile and you don't want to do anything crazy. So I know I've seen some people talk about doing like these extreme, go up like this and stretch your back. Stay away from that. Instead, stretch the bum by basically hugging your knee like this. I'd only do one knee at a time for now, but basically how this would look is you'd be lying on your back and you hold on to your right knee, or whichever knee is on the more painful side of your back is usually the better one, and then try to bring it to your chest. Hold it there for about 10 seconds, and if it's not causing you any big lightning shocks down the leg or any super uncomfortable pain that's getting worse, you can continue to bring your right knee to your left, basically your left nipple, where you're crossing it over. That's a stretch right here, but it's really good to stretch this area because number one, this is probably not the spot you injured, so you can be a little more hard on that. But it's also good because doing this often will calm down the low back. It's something I've seen work a ton of times, and especially if you're going to be lying down, you might as well do this stretch every couple hours just to take the pain down. So that's 6 things you can do if you hurt your low back. Like I said, go check with your healthcare provider because these can be severe. I've seen people end up in the emergency room for these. But I have also seen that oftentimes, aside from the medications and all that, the biggest thing you need to do is just follow these 6 tips. And also just remember that it will get better. You just have to kind of let time do its course to help you heal. And by doing these kind of things, you will get better quicker. And if you like this video, please subscribe to Riley Rehab because I'm going to be coming up with more content every single week for you guys. And I'll see you next time.